We have more stories. Please stay tuned in. Now, Ghana's COVID-19 cases are rising steadily, with the daily case count trending upwards from 80 to 138 in just a week. Now, on the dashboard, the very latest 138 new cases. Active cases have gone up to 1,849, bringing it to a total confirmed cases of 96,846. 797 people have died from COVID-related deaths, and 94,200 have recovered or been discharged. The Ghana Health Service is asking Ghanaians to be on high alert as it works to contain the deadly Delta strain of the virus detected in students and teachers at the Achimota School. As many as 163 persons were found to be positive after testing was done on 1,118 samples. Director of Public Health at the Ghana Health Service, Dr. Franklin Sedubekwe, says they are restricting movement to and from the school as they work to prevent a spread to the community. Dr. Franklin Sedubekwe joins me on Zoom for a conversation. Thank you very much, Dr. Sedubekwe. Now, what would you say is accounting for the uptick in COVID-19 cases in recent days?
Yes, thank you very much. So, if you look at the data, we are getting cases from three main regions. So, Ashanti, Greater Accra, and Ahafo region. And for Ahafo region, is in a district, City Field North, whereby they have an outbreak in the workplace. So for Ashanti, you have cases in Amansia Central, Amansia South, and Secretary South. So these are also kind of workplace outbreaks going on. And then we have Greater Accra, that is from the Achimota School. So these are kind of localized outbreaks occurring in these three districts. So in the remaining 13 regions, you don't seem to have cases. So these are actually the main reasons why we have the surge in cases.
Now, you say that we don't have cases in the remaining regions, but is it a case that we're not testing and that's why we don't have those cases?
No, we are testing. If you look at our update, you can see that there has been a gradual increase in the number of tests being done. So, clearly, if you look at our protocol or our guideline, we test based on clinical suspicion, and then that one you generate contacts, and that one will be the basis for further testing. So basically, that's what we are doing. So I think the other regions are not getting the cases. The others that have cases, they are doing contact tracing, and we are generating more cases. So clearly, we are testing, and then the cases are not in those other regions.
All right. Now, does the health service have a grasp of the situation at Achimota School, which you mentioned, and what is the plan to contain the situation?
Yes. So clearly, let me tell you that Achimota situation is really stable. You have a situation whereby you have two streams of students. So you have day students and you have boarders. And then you have an initial report of 3 students. Immediately, the health system is alerted, and then they isolate them and test them, and then they do contact tracing. So they further identify more contacts, and then they put them under isolation. The other issue is that you have a situation whereby you have day students. So the idea is that what do you do to these day students? So we try to test all the day students. We've actually done the testing of the day students. We've gone ahead to do testing of the teachers and non-teaching staff. We've even given vaccinations from the teachers. So clearly the Achimota situation is contained. This is an outbreak in the confined environment. What is good for us is that we're able to ascertain that we have a Delta variant in the country, in the community. So I think that the health system is in charge of the situation. And let me also state that we have actually done over 1,000 100 tests. And the results is that we have about 183 positive cases, but about 4/5 of them have been discharged. Currently, as I speak, we have just 46 cases being active. So it's a situation which is under control.
Right. Now, are you able to say if any deaths have been recorded yet of people who have been found to have been infected with the Delta strain of COVID-19?
You see, the Delta strain, it's early days yet in the country. If you look at our genomic surveillance over the period, it started more than a year ago, but it is not like case-based. So normally you do a kind of a batch testing to ascertain whether you have the variant. So as we have actually shared across, the most dominant strain in the country has been the Alpha variant. For now, we don't have the data to link deaths to Delta strain. Let me also state that it's only very early that we've actually been able to isolate the Delta. So we are still watching, and we are actually ramping up our genomic sequencing. Now, as I speak, we have about 4 institutions that are doing their genomic sequencing in Ghana. We have Noguchi, we have UHAS, and then you have WACPIC. So they are all doing the testing. So it's getting bigger and bigger, and hopefully we'll get a full grasp of the situation of Delta in the country.
But looking at the death rate, would you say we've seen a significant increase in recent days?
You see, if you look at the data going around globally, the Delta strain is more efficient in terms of transmission. It doesn't really do a lot of mortality. So for now, Ghana, you can see that we have a gradual increase in cases, but we don't have a corresponding increase in number of deaths. We are seeing a little rise in severe cases, but it's not as profuse as we used to have in the early part of the year.
Right. Now that I have you on, I know that the 138 new cases that we reported is a while back. What's the very latest that you have on the dashboard?
I think that's what I want.
No, I think the national COVID dashboard.
Okay. So I think I went off. Let me see whether I have it.
All right. Now, whilst you look at it, then the final question I'll be asking you is the Ghana Health Service has been concerned about the lack of adherence to the preventive protocols in recent weeks, and what is the plan to improve adherence? But for now, if you have the latest COVID stats from the dashboard, you may want to share that with us, and then we can...
So for the active cases is 1,893.
Right, it's gone up again.
Yes. So, and then the cumulative is 96,971.
And the new cases, how about the new cases?
Pardon?
How about the new cases you have?
The new cases,
because we had 138 at the last count on the dashboard.
These are 125.
125, so it's been a marginal drop.
Yeah, so I think now we have somehow entered the hundreds. So you can see that we have actually been increasing gradually over the past 3 weeks. In terms of trying to get Ghanaians to appreciate the
protocols,
I think you were crowned an ambassador a few weeks ago. And we would like to rely on influencers like you to actually send a message across. What is happening now is like what was happening in November and December and in October. When the cases are not so profuse and people are not seeing deaths, they say that the disease is gone. It's very challenging to convince people that the disease is gone. So somehow the detection of Delta was supposed to send some fear in the system. It's not so much agitating the Ghanaian. But we hope that Ghanaian will appreciate the fact that COVID-19 is not gone yet.
Yeah.
And I think that even though we are getting vaccinations, we don't have the right numbers to be able to let us lose our guard.